Thanks everyone. Of course, I'm over here at Clark Regional Medical Centre. This is Dr. Reynolds, and you know, I've shared the story about my father dying of colon cancer as we speak. And of course, March being Colon Cancer Awareness Month, I want everyone to show at home that what you go through to not only have a consultation, but what is at risk for me at my stage of life. So
sure.
Where do we start? Of course, I've come in, I've had a weight check. You know, we don't like to know about the weight,
right.
But we've had blood pressure and also temperature as well.
Right. So, you know, when you come to the office for a consultation, it's really nothing more than that. We want to check your overall health and really assess your risk factors for colon cancer. So certainly you're right. Having a father with colon cancer or any first-degree relative, mom, dad, brother, sister, does put you at higher risk for colon cancer. So we know that with people like you, Troy, we have to be more careful.
Yeah.
Okay.
Okay, so in saying that, what is the average age that someone who is not at risk or you should be having screenings done? What is the guidelines at the moment?
The recommendations currently are age 50 for most of the population. So that is not counting, again, the people who are at higher risk because of family history.
Okay.
Also, there is a newer recommendation that African American populations be screened at age 45. So
wow.
Really, we're looking at 45 and 50.
Okay. So what happens when you come in and I say to you, Dr. Reynolds, that, you know, my father is dying of colon cancer? What are the steps that we need to go through for someone who is at a higher risk like myself?
Sure. Of course, we want to have an assessment of your overall health. Do you have high blood pressure, diabetes, things such as that?
Okay.
But important to me today are you having any symptoms of colon cancer, which we would consider putting you at higher risk for actually having it?
Okay, I understand. Is it the same for men and women, or is it different tests?
No, everything is the same for men and women.
Okay, in same age brackets as well?
Yes.
My sister just had a colonoscopy because she also felt she was at high risk, and also she's not 50 either.
Right.
So when she called me, she said, "Hey, brother, I'm all clear." She said, "No, when are you booked in?" You know, and that, I have to be honest with you, I'm nervous sitting here talking to you about it.
Well, that's very common choice. So as far as age goes, again, when you have a mom, dad, or brother, sister with colon cancer, you should start screening at age 40, even if you have no symptoms whatsoever.
And how often should I be screening?
If your exam is negative, then it's going to be every 5 years. However, if we find polyps or precancerous lesions of tissue, then that will be based on what we find on the day of the exam.
Okay. Now, an important question that everyone at home will want to know: how much of this procedure is covered by insurance, or is it covered by?
Sure. I can't speak to every insurance, but very commonly commercial type insurances will cover this as a screening test. Some 100%, some not. Again, you can reach out to your insurance provider and get that information easily. Okay,
well, we're going to finish it up here. We're going to come back after the break, everyone, and do part 2 of what's next for me. Back after this short break. Welcome back to Midday Kentucky, everyone. As I just said before the break, I'm over here at Clark Regional Medical Centre with Dr. Reynolds, and we're talking about colon cancer.
Right.
And where I'm at in my life, considering my father is dying of colon cancer. I wanted to ask you, which I think is really important, is what are the signs that I may have, or symptoms that I may have, that I should be checking at home?
Sure. I think, you know, there are a lot of things that you have to take very seriously. One of the bad things about colon cancer and many forms of cancer is there are not a lot of symptoms. But things that you might want to be aware of, you know, a sudden change in your bowel pattern, diarrhea, and especially bleeding from your bottom. That is certainly something we have to take very seriously.
Okay. All right. So I don't have any of those symptoms that I'm aware of. Maybe I should start checking as well. Do you know what I mean? Like, I haven't thought to check those things.
Right. Usually, again, bleeding is the thing we worry about the most, and that's not very glamorous for sure, but, you know, when that happens, that really keys us to say that, you know, we really need to get this checked out.
Okay, all right. So, we're definitely having the colonoscopy because I am at a high risk. What's the process? Talk me through. I believe there's a drink that I drink, or I have to prepare the body.
Everyone's favorite part.
Talk to me through that.
So in order to prepare for a colonoscopy, your colon or the large bowel has to be clean. So you do drink a laxative type drink that flushes the stool from your colon.
When?
We typically do that the day and the night before.
So I know what I have to do before the day. Now, I'm on the day.
Right.
What does the procedure look like, and what are you looking for?
Okay, good question, Troy. So on the day of your colonoscopy, you're going to come in to the outpatient surgery center, and you'll get an IV in your arm, and medicine will help you go to sleep. So there's no pain involved. It does not hurt, it's not uncomfortable, and you don't remember any of it. What we do with the colonoscopy is we're looking at the colon or the large bowel, as you see here. So I can outline that for you. The scope examines all of the colon. We go all the way around to the very end, and then we slowly withdraw the scope to look for polyps or precancerous lesions or frank cancer, which you can see right here. So the nice thing about colonoscopy, it is a preventative measure. There are certain tests that detect colon cancer, but colonoscopy can also detect precancerous lesions. So we might have a full-blown cancer here, but if screening is done properly, often we can find the cancer at a stage such as this, to where it's just precancerous or a polyp, and that can be easily removed on the day of your examination. So, and there is very little risk in doing that. So the important thing to know is that follow the screening guidelines. Listen to your body, listen for symptoms. Remember that if you have a family member with colon cancer, that you are at higher risk, and you should take this very seriously. And if you have any other questions, you can call our office and we'd be glad to answer them.
That all looks very well, Dr. Reynolds, but I want to ask you, what happens after the process? I've had the operation, then what? What happens if you find some polyps?
Sure. So after your colonoscopy, we give you some time to wake up. If we found polyps or just small precancerous lesions, then there's nothing to worry about. We have removed them at that point.
Okay.
If there is something more worrisome like a cancer, then the day of the operation we'll set up CT scans to make sure the cancer is not anywhere else, and we'll make a referral to a surgeon who can remove the cancer. The good thing is that if it is detected at an early stage, it is very curable. Sometimes surgery itself is curative without chemotherapy or radiation.
Okay. Oh, I didn't know that.
Yes.
All right. So what happens if I have the all clear? Then what?
So with your family history, Troy, it'll be every 5 years that you should have a colonoscopy.
Okay.
However, if a normal person without family history is completely clear, they can wait up to 10 years.
Really? That's that long?
Yes.
Wow. Well, Dr. Reynolds, I appreciate the insight. I know I have to have the colonoscopy, and that's something we're going to be doing. So if you want to find out more information about Dr. Reynolds, and maybe you're at risk, you need to come over and see Dr. Reynolds at Clark Regional Medical Centre, everyone. It is the thing to do. It's Colon Cancer Awareness Month. It's a difficult topic to have that conversation about, but all the information's up on the screen. We'll be right back after this short break, everyone.